Hey Matthias, great to have you here today with us at the World EPA Congress in Amsterdam. And we met already last week in Brussels and we spoke a little bit about this project which you and EUCOPE are supporting, which is this genomic profiling project. Can you tell a little bit more about what it is?
No, I'm very happy to. And this has come about over the past couple of years, really because, EUCOPE, we are an industry association, represent primarily pharmaceutical companies, but also a growing number of advanced diagnostic companies. And what we have seen is these type of companies that develop genomic tests that are used in primarily selecting patients for targeted treatments in cancer, can also be for rare disease, are facing a lot of challenges when it comes to bringing their products to the market. So the time to bring products to the market is very slow. It's very protracted in Europe with long delays compared to that of other regions. And so we have set up a working group within EUCOPE where we try to address this and engage at the national level with the member states. And we've also recently established this coalition, which is the ECGP. It's a multi-stakeholder coalition, which means that not only is it bringing, and for the first time I have to say, pharmaceutical companies that develop targeted treatments, advanced diagnostic companies that develop the diagnostics that are used for selecting patients for these treatments, together under the same umbrella, is also bringing in clinicians, pathologists, patients, and also health economists, because this is really a complex area, as you will see today, and you really need all minds together to solve it.
Wonderful. I think it's always a certain effort to bring these healthcare system stakeholders together to convince them that such a coalition makes sense. What were the responses of these different clinical experts, companies, healthcare system experts to work together?
Very positive, I have to say. Although, of course, I think it's can be quite a crowded space already, even in such a small area, and there are other coalitions out there. And they are doing great things, and there's coalitions such as FT3, PCC, and we are collaborating with them as well, but they're focused on slightly different areas. So some of them are global coalitions, some of them are more focused on awareness raising, whereas ECGP, we are really trying to address the slow time to reimbursement. So we're trying to speed up reimbursement for genomic testing so that patients don't have to wait so long. We have seen that some of these tests take a very long time to come to reach patients in Europe. There's one example of a test, and it's used in neoadjuvant breast cancer, which means that if you have had breast cancer surgery for breast cancer, then you might or might not benefit from chemotherapy to manage the possible return of your cancer. Now, of course, when you don't have personalized care or personalized treatment regimen, then everyone will receive chemotherapy, whether you benefit or not, and of course with all of the harsh side effects.
Absolutely.
Now, if you're able to do a genomic test and you can figure out what specific type of cancer you have that has led to that breast cancer, you can also tell whether you would benefit from that receiving that chemotherapy as well. And this test, which was first available in the US as soon as 2008 or so, I believe, was only available in Europe, in Germany first, and then the UK, almost 10 years later.
Wow.
That's a very long delay. It's a very long time to wait.
Wow. I think that's interesting because, especially in today's geopolitical situation where we see a lot of turbulences and uncertainties coming over from the US, I think this is an example which is also maybe telling a little bit about what we can expect for the pharma industry in general. So, but to see these developments which are technically available have such a delay. Do you see also this delay within Europe, so that it's coming first to countries like UK, Germany, and later maybe to smaller countries, mid-sized countries, Central Eastern part?
I would say this is generally true. Of course, these diagnostics they have different uses, and we can go into that because it's not just treatment selection, as you had in breast cancer, for example. It can also be to select follow-up treatments. It could also be selecting patients that should not receive a treatment. That can also mean a personalized treatment regimen. But But we do see that overall there are differences between some of the countries in Western Europe and Eastern Europe. However, what's interesting is there was a study a few years back that looked at access to genomic testing in Europe, and if we look at Europe overall, there is this divide. But if we then look at differentiate between how is access to smaller tests, so when you test for just a single gene or a single biomarker, or so-called hotspot testing or panel testing, where you test for the most well-known mutations or biomarkers, compared to when you really test for a lot of biomarkers in a single test, then you start seeing a big difference as well within Western European countries too. So this is not just an issue of let's say purchasing power or how the traditional setup of healthcare systems, etc. There seems to be other things in play here as well. Because even if you compare countries such as France, Germany, Italy, and Spain, there are variations in terms of access to these types of tests.
Do you have the feeling that these are also mainly smaller and mid-sized companies which are developing this kind of technology, and for them it's not so easy to have the experience with the healthcare system, with the pricing and reimbursement, especially because we see that many of these tests are not reimbursed nowadays, and so patients are missing out on this opportunity to get personalized treatments finally. Do you think they can benefit from some experience from bigger companies or from consulting companies?
Certainly, I do think so. I mean, this is one of the reasons why this group has been established within EUCOPE in the first place. Is because, I mean, a lot of these companies don't really have a path towards commercialization in Europe. As you heard, it's very slow. We've even seen examples of companies that have spun out of European universities that then they would like to go first in Europe, but they have to really go and commercialize in the US. And why is that? It's because the path to reaching the patients is so slow in Europe. Now, that of course means that, you know, at the end of the day, you have to finance the development of the product some way, so you have to go to the US first. Now, this is what we want to address, is that we want to really speed up this time to reimbursement in Europe. And there's a lot of learning along the way, I think, both from each other. Pharmaceutical companies, of course, are quite familiar with the processes, but they really rely on diagnostic companies, you know, to really provide these diagnostics on the market. What we have seen traditionally, in some cases, which is what we want to avoid, is where a targeted treatment is approved, and then maybe, you know, even it moving towards reimbursement, and then the diagnostic is not there yet.
Yeah.
And then no one will be able to access this treatment. No one will be able to benefit from it. A lot of countries have now, you know, taken steps to avoid this, so that the diagnostic and the treatment will be available at the same time. But it's still quite challenging because there is no thing such as the Transparency Directive, for example, for diagnostics. For pharmaceutical products, generally, you have to member states have to make a decision on pricing and reimbursement within a set time frame, 180 days. Yeah. For diagnostics, there is no such thing, so it's really up to each member state. As a pharmaceutical company, you typically have a well-established process for applying for reimbursement, for placing a product on the market. So there's a pathway towards reimbursement. But for an advanced diagnostic, there is often the pathway is very different from one country to the other, so it's even more complex to navigate. And you can imagine that if you're a smaller company with much less people that have primarily been looking at the US and you want to go into Europe next, that is quite challenging.
It's difficult, yeah.
And I just want to say that I was surprised to learn that in many cases, if not all, advanced diagnostic companies themselves cannot apply for reimbursement. They have to rely on a scientific society or someone else to let's say, put forward a candidature for their product.
Very true. Let's go back a little bit to the European coalition which you are supporting. What are the 1-2 major objectives right now to bring this to the next level and make this more available for patients?
Yeah. So I'd mentioned that what we're saying is that within some countries there are there's some differences between the countries, and it's really due to regional differences. So, for example, we have in this study we saw that was conducted a few years ago. We saw that especially Spain and Italy, there's large regional variations. So some regions are currently providing access to CGP, whereas some of the other regions are not. So you really have some regions that have gone ahead, that believe in the value of this, that the payers also are convinced about the value of this, so they provide access, whereas in other regions it's not. And it's because they have a decentralized system, so you have these differences between the regions. So what we are doing there is that we have, in Spain, for example, decided to partner with a few regions, so with the decision makers in the Catalonia region, in the Valencia region, and in Aragon. And last year we have held a series of discussions where we have really brought together the different people that are involved in this, from the hospital, from the regional governments that are in charge of developing the personalized medicine plans, and they have had discussions about what is needed in terms of establishing the equipment, in terms of bringing in the people that can do these tests, that can and analyze the results of these tests as well, and that can also often be a bit of a bottleneck, and really to make sure that there is a concrete plan to bring it to the patients.
So a lot of communication needed.
And that can sometimes be the blocker, is that let's say all of these things need to work together. On the other hand, in some cases there is not any decision to even reimburse it at the national level, and that is of course a main criterion to have access. If it's not considered within the basket of care, then you cannot access it as a patient. So here you really have to ensure that decision makers that are taking these types of decisions, for example in Italy, another country we looked at, they have recently updated the LEA, which decides what is included in the service that will be reimbursed. Now, I'm very happy to say that they have been including genomic testing, but they have not yet included CGP. And the difference here is quite important, because genomic testing can involve just a single gene testing, hotspot testing for the most commonly known genes, but this is a very rapidly evolving field, and more we are moving towards including more and more biomarkers into a single test. And the laboratory equipment is also being set up so that you have, it's being set up towards, of course, doing the broader testing. And that means that we really need to aim to reimburse the broadest test possible that actually brings value. And sometimes this can be slow moving. In Italy, we're not there yet, and we are in partnering with some of the KOLs in Italy, also with the Italian Industry Association, also Biotech, to follow up with the national decision makers there, to have a conversation about what is the value of CGP, why does this need to be included in the basket of care in Italy.
Yeah. Let me pick up on that one. I mean, you just described a quite interesting situation, which is super fragmented, which needs a lot of education, which needs a lot of communication amongst the different stakeholders as well. Do you see an above-country initiative here or willingness from the European Union to support that? Because, I mean, first of all, it can help a lot patients to get the right treatment in time, faster. But on the other side, also to save a lot of money in the healthcare system, because wrong treatments are eliminated or diseases are eliminated.
I think probably the strongest signal that the EU has sent has been Europe's Speeding Cancer Plan, which is now being reviewed currently by the European Parliament.
And will include most probably this profiling, or?
They have singled out a few things. One, they made a commitment to leave no stone unturned to make sure that patients have access to the highest quality diagnostics and treatment. So they see the both of them as going together. There was a large focus on personalized medicine therein, and they have launched a number of projects as well, which are still ongoing. So we still need to see how they what they lead to. But one of them is that they have established, based on the learnings from the area of rare disease, they have established some reference networks within specific areas for cancer, and one of them is in genomics as well. So I think they absolutely do see the value. There is also very clear learning, I think, as well from the COVID-19 pandemic, where you saw that you really need to have a high sequencing capacity as well within you, because we had to test for all of the new variations of COVID, etc. And this was based on PCR testing, so it's not the newest advanced type of testing, but nevertheless, we're talking about sequencing capacity. And in the mission letter to the new health commissioner, there was a clear signal to increase the sequencing capacity of the EU. So I think this is absolutely on the radar up at the highest level in the Commission to overall look at this. Now, the European Parliament has also specifically called out in their report on Europe's Beating Cancer Plan that the main barrier is, of course, to ensure reimbursement of these tests. And they have called on member states to both ensure fast, efficient reimbursement and to earmark financing for reimbursement of advanced diagnostics.
Yeah. No, very interesting, and thanks a lot for telling so many details, and it's great to see the passion that you are supporting this initiative, because I think it's absolutely substantial to ensure that the right treatments are reaching patients in cancer, but then also in many other diseases. So thank you very much for today's discussion, and I think we will hear a lot more about that in the near future. Thank you very much, Matias.
Thank you, Herbert, and feel free to follow us on ecgp.eu and you can learn more about our coalition.
Wonderful.